to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borrelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. Welcome back to a new episode of Ask the Patient Advocate podcast. Today we're talking about an important and deeply personal topic for many families: navigating Down syndrome. Whether you're a parent, a caregiver, or simply someone wanting to understand this condition better, our goal today is to shed light on what it means to navigate life with Down syndrome and how advocacy can make all the difference. So joining me today is Christine, a member of our team. Welcome, Christine. How are you?
Hi, I'm doing great, Dr. Borrelli. Thank you so much for having me here. So, let's start with this. For those who may not be familiar, what exactly is, Down syndrome? Can you further explain it?
Absolutely. So Down syndrome, or trisomy 21, it's a genetic condition that happens when an individual has an extra copy or even an extra part of chromosome 21. It's usually diagnosed during pregnancy or right after birth, but people with Down syndrome often share some physical traits like a flatter facial profile, slanted eyes, or lower muscle tone. But it's important to remember that every person with Down syndrome is unique. Each has their own unique personalities, abilities, and challenges. So care really needs to be individualized. And I think that's so important to remember.
Yeah, I agree with you. And that individuality is such an important point, I think, but medically speaking, what other health issues might families need to be aware of?
So people with Down syndrome can have a higher risk of certain medical conditions. This includes congenital heart defects, thyroid disorders, GI issues, so gastrointestinal, hearing or vision problems, and many more. But those are just kind of some common ones that they're more a higher risk of. Some of these conditions can be detected right away, while others might appear much later in life. And that's why ongoing follow up with healthcare providers is so crucial to make sure that we catch things early and support the best possible outcomes. And a lot of times, you're going to need a specialized professional who has experience managing patients with Down syndrome because they do have higher risk factors for certain things. They present differently, and the management's going to be different compared to somebody that does not have Down syndrome.
Yeah. Well, you know what, Dr. Borelli, I can only imagine how much, there is to keep track of, like appointments, therapies, medications, and of course, school support. What would you say to parents or caregivers who are feeling overwhelmed by it all?
That's such a great question. The truth is, you're not alone. Even though it may feel that way at times, there are so many resources available. Many families benefit from Down syndrome specialty centers where a coordinated care team exists, doctors, therapists, nutritionists. They all work together to support your loved ones. And for families who don't live near one of these centers, telemedicine can now connect you with specialists virtually. It's all about building a support network that helps your loved ones and also supports you.
Exactly. And that's where advocacy really comes in, right? Can you share how private patient advocate can help families caring for someone with Down syndrome?
Absolutely. So, a private patient advocate can make a huge difference in managing care and reducing stress. We can help coordinate medical appointments and therapies. We can communicate with doctors and specialists, review medical records for errors or missing information, handle insurance issues and authorizations, arrange additional caregiving or transportation. I mean, that's just a few of the things. Again, every plan is individualized because every situation is unique. We also help educate families, empowering them to advocate confidently within the healthcare system. That support helps ensure that your loved ones receive consistent, high quality care without everything falling all on your shoulders.
Yeah, I got you. You know what? That's such a valuable insight. And to wrap up, what would you say to parents or caregivers who are just beginning their journey, with Down syndrome?
I would say take a deep breath. You don't have to have all the answers right away. There will be challenges, but there will also be so much love, growth, and joy along the way. Seek support early from medical professionals, including private patient advocates. And remember, you are your loved one's greatest voice. You know them best, and your advocacy truly shapes their care and quality of life. And we want to help support that as your private patient advocate.
Yeah, beautifully said, Dr. Borelli. You know what? Down syndrome is a journey filled with learning, love, and community, right?
Exactly.
And with the right support, families can truly thrive. So, for anyone looking for help for themselves or for their loved ones, there are so many ways to reach out to us. You can visit our website at www.pathwaypa.com.
Thank you, Christine. It's been a pleasure as always. I hope that this conversation helps our listeners feel more confident as they navigate their healthcare journey. Have a great day. If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.